Welcome everyone to the Revive Awareness Day press conference. And I'm Beth Smith. I'm the health officer for the Florida Department of Health here in Okaloosa County. I'm so grateful to have all of you here today in recognition of Revive Awareness Day. And for those that may not know, Revive Awareness Day was actually signed into law by Governor DeSantis on April 8th with Senate Bill 66. And through that law, the Florida Department of Health has been tasked with bringing awareness to communities about the dangers of opioid overdose and reversal drugs like Narcan. We have an exciting program for you today, and that includes remarks from several of our key figures that are working closely to address the opioid crisis in our community. But before we get started, I want to invite you to join in on our efforts with our Okaloosa County Health Improvement Partnership, or OCHIP as we call it. And there's an informational table, a couple of them over here on the side. On those tables includes resources, local resources for overdose use. We also have Narcan in the back. We also have handouts and information on how to get involved. OCHIP is hosting an International Awareness Overdose Day on Thursday, August 29th. It'll be held at Cross Point Church in Niceville. It'll be 5:30 to 8. We'll be providing dinner, and the program is free. It's going to include testimonies from community members as well as a panel of those that's going to be discussing local actions that have lived experience. Before we move on to the next portion, though, I want to extend our sincerest thanks to a few members in the audience. First is to the Okaloosa County Board of County Commissioners for your steadfast dedication to these efforts in our community. Second, thank you to Northwest Florida Health Network for being such good stewards of these important funds that we are going to be able to use in our community. And last but not least, a special thank you to Deputy County Administrator Sheila Fitzgerald for her tireless efforts that have gone above and beyond to ensure that all the community partners and these funds have the greatest impact in our community. We're grateful to be such a partner and part of a monumental steps forward into our community with these efforts, and together, all of us working together can of course make a lasting change. So thank you and welcome, and have Commissioner Mixon.
Thank you, Beth, and thank you for the great work that you're doing since you have moved here to our wonderful community. It's great to see the partnerships, the OCHIP, and the opportunity that we have to see everyone come together and work. You're here because you have been impacted or have seen the impact of the opioid crisis. And so thankfully our governor has taken action on that, and we as a community are taking action on that. I would like to present a proclamation. It's designating June 6th as Revive Awareness Day. And I'll read this to you. Whereas on April 8th, 2024, Governor Ron DeSantis signed legislation referred to as Victoria's Law that designated June 6th of each year as Revive Awareness Day. And whereas the Center for Disease Control and Prevention reported more than 100,000 overdose deaths in the United States during the 12-month period that ended February 2023. And whereas most of these deaths were caused by illicit synthetic drugs, they were manufactured fentanyl, often in combination with other drugs, and whereas in 2021, nearly 71,000 drug overdose deaths involving synthetic opioids occurred in the United States, which was more deaths than from any other type of opioid. And whereas 60% of all opioid overdoses, the deaths occurred in the home, whereas in 67% of opioid overdose deaths, another person was present at the time and witnessed the death. And whereas opioid antagonists are a safe, powerful medication that can reverse opioid-related overdoses and prevent overdose deaths, And whereas in 2023, in a historic action, the United States Food and Drug Administration approved naloxone nasal spray as the first over-the-counter opioid antagonist. And whereas most Americans remain unaware of the safety, availability, and efficiency of opioid antagonist as a life-saving treatment for opioid overdose. And whereas the Healthy Behaviors and Healthy Communities Working Group of the Okaloosa County Health Improvement Partnership have identified several strategies, including public safety and education, to accomplish the goal of reducing incidents of opioid overdoses and deaths. Now therefore be it resolved by the Okaloosa County Board of County Commissioners that they do hereby proclaim and recognize June 6, 2024 as Revive Awareness Day. This was passed on the 4th of June by the Board of County Commissioners. OCHIP, thank you for the work that you're doing. I look forward to see how we continue really aggressively battling this issue within Okaloosa County. Beth, would you like to come and receive this?
Yes. Good morning, everyone. Good morning. Better than that. Come on, I'm tired. Good morning, everyone. Outstanding. Thank you so much. I'm Pat Maddox. I'm your Director of Public Safety for Okaloosa County, and thank you so much for being here today to share this honor with us. Daryl, if you would come up here with me, please. Although I'll be the one doing the speaking, I want to recognize Daryl Wellborn, our EMS chief, because it will be he and his team who will be doing the majority of the heavy lifting in this effort. And not only that, he just looks outstanding in a Class A jacket. So welcome, Daryl Wellborn. Yeehaw. Now, I generally don't read from paper during remarks, but I don't want to miss anything on this. I want to get it right, and I want you to understand everything that's in my head on this. So I am going to read some prepared remarks, so bear with me as I get through this. We're here to talk about community paramedicine here today for what we're doing from our side of the house with EMS. And community paramedicine is an emerging field in healthcare where EMS providers are able to operate in expanded roles to increase access to care, facilitate appropriate use of emergency care resources, and provide referrals to programs and support which were previously hard to find. This is what happens when a team of strategic partners like yourselves just simply responding to crisis and progress is not enough. We've got to not only get ahead of the problem for people at risk, but provide robust follow-up to prevent the problem from recurring and affecting other members and portions of our community. In the case of this unique program, which is funded by a combination of core program dollars and regional abatement fund dollars, screening and treatment will specifically be focused on opioid use disorder and its associated comorbidities. Okaloosa County EMS will begin its community paramedicine program with a team of 2 community paramedics who will be specifically assigned to this function rather than 911 response. They will travel in a response vehicle adorned with a full-body vinyl rig wrap with graphics designed to bring attention to the opioid epidemic and available modes of treatment. They will carry with them specialized equipment and educational materials to assess and treat those suffering from opioid use disorder and its associated comorbidities with the goal of connecting the dots on additional resources when appropriate, which is something that we have not traditionally been great at in the past, and this is going to change that for us. Some of the program highlights are, this is a mobile program, so it can occur in a home, on site somewhere else, and for those experiencing temporary homelessness, it can occur on the side of the road if necessary. Individual screening and treatment for opioid use disorder and associated comorbidities. These team members will not have the responsibility of getting back into service quickly because they have to respond to the next 911 call. They will be able to spend time dealing with individuals, understanding individual concerns, and dealing with individual challenges, which is outstanding. Medication monitoring and reconciliation. As we know, opioid addiction can occur by accident through completely legally prescribed medication. And these practitioners will be specially trained to look for those interactions and to look for those circumstances and intervene through their primary care providers when necessary. The iStat blood analyzer with test cartridges specific for this effort for monitoring blood levels for associated comorbidities and the opioid use disorder. Providing education on the dangers of opioid addiction and follow-up and referral to additional programs and resources with strategic partners like yourselves throughout the core network. Although we wish there were not a need for this program to grow in size and scope, we believe that the success of this program will command it. The goal of these efforts is to provide timely care, education, and support for people in crisis as a result of the opioid epidemic, and to bring together the outstanding combined efforts of our strategic partners to reduce recidivism in incidents of overdose, emergency room visits, and serious injury or death. And now you're going to hear from some of our strategic partners who will open your eyes to the amazing programs and services they will provide in furtherance of this effort. So I thank you for your attention today, and I believe our next speaker is our esteemed CEO of Bridgeway, Bonnie Barlow, who will be happy to discuss it with you further. Thank you.
Good morning, everyone. This is truly a historic event. It has been 14 years since Okaloosa County has had a 24/7 detox. And when I became CEO, that was the comment I heard most often. We need a detox. Why did you guys close it? We need to get it open. And so I am so excited to talk about what we're able to do because of the core funding and the partnership with Okaloosa County. We are able to enhance our critical services through this funding by extending the availability of our detox from 12 hours to 24/7. This is a significant expansion, and it brings vital resources to Okaloosa County, making around-the-clock care available for those that need substance use detox, medication-assisted treatment for opioid use, and integrated patient care for first responders. As we continue to battle the opioid crisis, Bridgeway Center remains committed to providing essential life-saving services. The expanded 24/7 detox ensures that no one in need will be turned away, regardless of the time of day, and that is huge. This expansion marks a pivotal step in offering a beacon of hope to those ready to embark on their recovery journey. Participants in Bridgeway's detox program receive compassionate and comprehensive care from skilled professionals, nurses, and doctors that will support their recovery. The program is accredited by CARF International, which is a nationally accepted industry standard best practice accreditation, and that ensures excellent quality of care, evidence-based practices, and a quality participant experience and positive outcomes. We will tailor services to the unique needs of each individual, providing treatment plans and connecting them with appropriate services, whether it's through Bridgeway Center or through our community partner agencies. This is a person-centered treatment planning and a low-barrier method, and it will ensure a secure support network, and hopefully our people, our clients, will feel empowered to continue their journey of recovery. It is very difficult, and they do need a lot of support, and we have that for them in Okaloosa County. So we are working with existing programs. The partnership that we have in Okaloosa County is tremendous and is not something that you see in every other county or across the nation, so we're very blessed to have that. It will make our community stronger and more resilient. We look forward to making substantial positive impacts as we work together to battle this opioid crisis through this vital expansion. And on behalf of everyone at Bridgeway, we cannot thank you enough for this opportunity, and so excited to see what the future holds. So thank you.
Thank you, Bonnie. Thank you, Director Maddox, for the introduction and the laying of some groundwork. I'm Robert Bates, Chief of Police for the City of Fort Walton Beach, and I co-chair the Healthy Communities Group with Mayor J.B. Witten from Crestview. I'd like to speak today about a battle that is fought in our community and in our nation. Every single year since 2021, there's been over 100,000 overdose deaths in the United States, with the vast majority of those caused by opioids, and fentanyl is one of the leading drivers in the opioid category. This number is comparable to the number of deaths in the Korean and Vietnam War put together. So that puts it into scope of the battle that is fought on our local streets. Florida is among one of the states with the highest per capita overdose death rates. And Escambia County to Walton County, which is our medical director's district, we've had some of the highest per capita overdose deaths. And as you can see on the slide up there, you can see Escambia County and Okaloosa County in the red. That represents 40 deaths per 100,000. You can see the other counties. There are 7 other counties in the state of Florida that have that same death rate from opioids, which is greater than 40 per 100,000. And you can see that we are higher per capita than counties such as Miami-Dade, Broward, Palm Beach. So when we are in that red, that is not where we want to be as Okaloosa County. So we examined the data locally, and we initially thought this was a problem from outsiders, from visitors that came to our local community. However, at least the data from Fort Walton, and I believe this data rings throughout the county, about 60% of our overdoses in the last several years on average came from local residents, somebody that had a Fort Walton Beach zip code. 15% of them were from neighboring municipalities, Crestview, Niceville, Valpy, and the other 15% were from the homeless population, and about 10% were from out-of-towners, from people that were from greater than Okaloosa County. So this really shows that this is a local issue. This is an issue that's affecting your neighbors, people you work with, people that you know. This is a very local issue and a very real issue to us here in Okaloosa County. Countywide, there was 471 doses of Narcan administered last year, 274 by EMS and 196 by other first responders. But there is some good news. Overdose deaths are slightly down in the state of Florida and across the nation. And I think programs like the programs that Bonnie spoke about, the program that Director Maddox is rolling out, and the program that I'm about to speak out, help move this needle in our direction. So I'd like to highlight a program that we're going to be rolling out at the end of this month. It is a post-overdose response team, or POST. We're going to pilot it in the city of Fort Walton Beach, but this program is so vital to the county that through the cooperation of the county administration and all our municipal partners, we will roll this program out countywide. The program consists of a law enforcement officer, an EMS paramedicine, or community paramedicine, and a clinician from Bridgeway. They will follow up at every single Narcan administration. They will do residential outreach, and they will offer the person resources that are available in our community and try to immediately sign them up for the available resources in our community. These types of programs have been shown to be successful across the nation and across the state, and the quicker we can provide services to people in need, the more likely they are to take these services from us. So in the following month, this program will go out countywide. And I'd really like to thank Sheriff Eric Aiden and the sheriff's support in this program, our municipal partners, the Chief of Shalomar's here, there's a representative from Valpy. I'd also like to thank, and she's already thanked, Sheila Fitzgerald, who allowed this program to become a countywide program. We will probably be the first area in the state of Florida that will have this countywide. In other portions of the state, it's either done in the unincorporated areas, it's done in incorporated areas, but I know of no county where this is a countywide initiative, and a lot of that had to do with the effort that Sheila put into this. Also, Greg Kane from EMS, who's helped us greatly on this, and then Emily Pickens was probably one of the greatest assets that we had to get this done countywide. Additionally, EMS will start a Your Life Was Saved program, and the kits are back there. If somebody wants to see what one of the kits look like, they're in the orange bags. The Your Life Saved kit has a dose of Narcan and also information on services that are available in the county, and they will be left at all Narcan administrations. OCHIP is also working to distribute Narcan throughout the community and do various community outreaches. I'd also like you to remember the DEA's campaign, One Pill Can Kill, because recent studies have shown that the majority of illicit drugs are laced with fentanyl at some level. So one dose, one pill, one encounter with drugs can lead to a devastating outcome. I'd like to thank everybody for joining us today. We're optimistic that all our programs will be beneficial to the community and the significant impact that they'll have to our community. We appreciate your continued support and collaboration, and the speakers and members of OCHIP will be available after this, and there's information at the various tables in the room. And I'd like to end by finally remembering the veterans who paid the ultimate sacrifice 80 years ago for freedom on the D-Day invasion. Their spirit lives on with us, and we must all rise up to face evil, no matter its location or form. Thank you for coming out today.